Welcome to our webinar. I am Dr. Ana Baptista at the New School University, and I have the pleasure today of introducing our guests today on this first webinar in our webinar series for the Centering Justice Community of Practice. Just for those of you who may not be familiar with Centering Justice, we are a group of centers and institutes across 9 different universities that are focused and committed to climate and environmental justice collaborations with partners across the country. And we formed this, community of practice to really help deepen our work, share best practices, amplify the work of our partners, and support our partners on the ground and the diverse body of work that they do. And we had our Centering Justice Symposium just a few months ago in Los Angeles, co-hosted with the University of Southern California's Equitable Research Institute. And at that symposium, we heard from a variety of stakeholders and community partners who are doing really incredible work on climate resiliency, really innovative work on the ground in communities that are facing some of the harshest climate impacts. And we wanted to take this opportunity to showcase one of our stellar partners at Drexel University and their community partners on the ground who are doing some of this groundbreaking work on climate resiliency. So Drexel University, and in particular the Environmental Collaboratory, is part of this group of 9 centers that are committed to advancing climate and environmental justice and modeling more equitable partnerships across academic and communities working together. And Drexel really, Matty's work and the collaboratory's work, it really exemplifies this approach. So we're very honored to have them be the first to present in our series. So I want to introduce Mathy Stanislaus, who is the director of the center. Mathy Stanislaus is the Vice Provost and Executive Director for the Environmental Collaboratory at Drexel University. And Matty joined Drexel from the Global Battery Alliance, which is a multi-stakeholder initiative established at the World Economic Forum. And at Drexel, he connects the Environmental Collaboratory to global and local partnerships. And he was also a founding co-director of the New Partners for Community Revitalization in New York. And he served for 8 years as a Senate-confirmed assistant administrator for the EPA's Office of Land and Emergency Management for the Obama administration. And I met Matty actually at one of the most intense climate resiliency periods that I ever experienced, which was during Hurricane Sandy. And even before that, I worked with Matty in New Jersey, and he was an incredible resource to communities on the ground who were suffering the worst impacts of Hurricane Sandy. So it's a real pleasure to have him kick us off in this webinar series and really thank him and his community partners for joining us today to share their expertise. Thank you, Matty. I'm going to turn it over to you.
Thanks, Anna. I really appreciate it. And just to reinforce, Anna, you and the leadership of the new school in really kind of organizing the centers who do the real work, in terms of co-leadership with community-based partners to really drive a community-based, community-driven approach to climate and environmental justice. So today, I really want to end with a sense of optimism from the perspective of actions that we all can take to protect our families, protect our communities. But I am going to hit you with some really hard facts around the gravity of the circumstance of extreme weather. Also, we'll have our 2 community partners talk about, Thi Lam from SEAMAAC and Drummond from Mantua, talking about the on-the-ground community-based circumstance. So with that, I have a slide deck that I would like to share with you all. So, a little bit about the Environmental Collaboratory, again, very much in terms of the centering justice approach of the new school and the 9 universities, really working in a co-leadership model with communities in a co-driven approach. So, what we've been doing for the last couple of years is really looking at what are the gaps and how do we address those gaps with respect to community-based approaches to meeting the moment in terms of increasingly severe weather. How do we protect communities from the greatest harm, if not to be able to invest in the resources to thrive? So the presentation that I'll walk you through is a product of inputs and recommendations from over 300 stakeholders from across the country, centered on the Mid-Atlantic region in terms of face-to-face engagement, community-based organizations, residents who've experienced flooding, experienced extreme heat, public health practitioners, officials, emergency management officials, other academia, energy, utilities, insurance, and finance, and partnering with a number of national organizations, Union of Concerned Scientists, National Wildlife Federation, others who are doing this work around how do we approach extreme weather from a community-centered way. So, I mean, we do know that disasters are more frequent and more impactful. So I want to walk you through some of that. So downpours, heavier downpours that we're already experiencing over the last week, 2 weeks, heavier, more frequent flooding happening in places that have not historically been the subject of flooding. As an example, in Pennsylvania, 93% of flooding occurs outside of designated flood zones, floodplains. And consequently, more flooding occurs there because the infrastructure has not been built to handle that. And then you have the consequential impacts on housing, infrastructure, health, and the local economy. So, I mean, we are in an era of heat, and it is growing significantly. Last 10 years has been the hottest period on record and is forecasted to increase into the future. The hottest days also coincide in the neighborhoods with worst air quality, with this compounding effect of bad air quality and high heat, which cumulatively results in the health effects that you see listed here. And just to underscore that extreme heat results in more deaths than all other natural hazards combined. And if you've been following the weather lately, you've seen this huge heat dome in Europe, in the past, heat domes across the US. This is most pronounced for older adults who have these effects from residents who have pre-existing vulnerabilities, from low-income residents whose housing may not be able to withstand the heat, may not be able to afford cooling. So we're also seeing wildfires as a regular occurrence, and also red flag notices have occurred across the country with actual wildfires coming from that occurring regularly. So this is the cycle that we're going to be in, and we need to figure out how do we protect ourselves from these hazards. We also have this a consequential event effects from this extreme weather. So I'm just highlighting the issues around chemical plants. It's an issue that I helped lead during the Obama administration. 1/3 of regulated chemical facilities under this Clean Air Act program are within the path of natural hazards. 3,000 of those facilities have released chemicals due to failures, due to power loss, resulting in reactions, pollution controls not working. And this most obviously impacts the frontline communities. There was a proposal to address this. There's actually a rule that is in place that this current administration is proposing to eliminate. So you have the impacts of these extreme weather events. So this is just a snapshot from 2024 when NOAA was in the business of documenting this. So it shows you all of the billion-dollar disasters, everything from flooding to drought to hail to severe weather. Um, Unfortunately, NOAA is no longer recording a billion-dollar disasters in this administration. So you also have the economic consequences. So there was an office, Department of Treasury, the insurance office, that collected insurance data from private sector, from state insurance agencies, and their conclusion was that 82% uh, residents in areas with multiple flooding events, hurricane events, were paying 82% higher in insurance. We're also seeing insurance being withdrawn from areas. These are both event-based insurance like flood insurance, but also property insurance. One of the striking conclusions by this report is the risk of what's called failure of mortgage-backed securities. So mortgage-backed securities, if folks remember the 2007, 2008 recession, was a result of these mortgages packaged into these mortgage-backed securities and leverage from that. And when the real estate values go below the mortgage, it creates risk and the cascading consequences. So there is this risk that the U.S. Department of Treasury Office forecasts. Unfortunately, this office is no longer collecting this data and no longer having these kinds of projections. A separate organization, First Street, projects 30% of foreclosures and $5 billion of annual credit loss due to extreme weather by 2050. And we're already seeing in places like Florida, real estate prices drop by 20 to 40% because of the absence of flood insurance. Now, I should note that a advisory committee impaneled by this current federal administration has recommended complete privatization of flood insurance. Flood insurance currently is about 95% a public market, just because historically flood insurance had more claim that can be paid, and the private sector pulled out of providing flood insurance. So if flood insurance is purely privatized, so that literally means flood insurance is not available to most people in America. So where does that take us? So we have this increased severity of weather having more impacts to communities in terms of loss of life, in terms of economic damages. And we have a system that was built decades ago. So we really need to look at how do we invest in that system, but also change that system. The current system is largely government-based. A lot of the response necessarily needs to be focusing on government assets, but we really need to broaden it to include all stakeholders, all community institutions to play a role and to understand the issues. So the one potential positive is a study by the U.S. Chamber of Commerce, which concludes that if you invest $1 today, you avoid $13 in the future. And those $13 includes avoidance of job loss, avoidance of economic consequences, and avoidance of damages. So this report resulted in findings of 13 major gaps in 3 major areas: community level, what are the key issues that needs to be done to protect communities at a community level, and what roles can community-based organizations play in that? What's the local government community interface? And then the private sector community interface. And the QR code is available in front of you. We could also make this available after this webinar. So just highlighting a few, and I'll go deeply into some of these. Early warning systems has consistently failed, and I'll get into that in a moment. We need to have really bring in the issues and representatives of vulnerable populations, representatives of handicap, the elderly, formally into the preparedness planning process, and have the emergency systems, which currently does not formally recognize partnerships with community-based organizations and other community institutions as part of their process. Making sure real-time data, knowing where flooding is occurring, knowing where evacuation routes are in a real-time way, cooling centers that are accessible, and ensuring that there's an all-of-government approach working with communities to address that. Insurance, I'm going to touch on, and public health systems. So let me expand upon kind of the early warning systems issues. So if you look at the major national disasters, if you look at Mystic Camp in Texas, you had you did not have sirens. You had notifications that were going out through Facebook. The Maui incident, you had notification. People don't know what direction they should take. The deaths in the California wildfires, did not occurred late to prevent death. The World Meteorological Organization, an international organization looking at weather-based effects, concluded that gaps in early warning systems is the most significant contributor to high fatality rates. In this country, much of the early warning messaging is based on what's called an opt-in system. So residents have to actively decide to sign up for the local emergency notification system. Unfortunately, that results in a maximum of 40%, and some municipalities as less as 10% of residents actually signing up, so they don't get the messages. So we really need to have a different process, a really more of a push-out process where everyone gets their message on in multiple of ways. And it's been tested in some places in this country, like Miami. But we also need to make sure that once a message is received, that people understand the message. We need to make sure that it's the correct language, but make sure it reflects understanding of the practices so communities can take action from that. Hence, the critical importance of trusted community partners helping design those messages. Now, we also need to have multiple pathways of delivering the message. While government-based messaging is really important, we really need to have redundant systems to look at multiple messages and multiple mechanisms, including bringing in community-based organizations to play a role and other community institutions. The other thing that we have to really address is this current circumstance of misinformation. So post Hurricane Harvey in Western Carolina, huge amount of misinformation threatened responders. Responders had to stop saving and recovering residents. So we need to actively deal with misinformation. So public health systems, one of the big recommendations that we had from our process from public health practitioners is that the healthcare system is currently not prioritizing prevention and preparedness from extreme weather. So we really need to have and partner with public health systems to both directly invest in preparedness and prevention and partner with community-based institutions, but also more rigorously develop systems to collect the data so that we can understand the severity of the issues, so we can better understand, for example, the need to intervene on extreme heat situations, and to better train professionals to diagnose early on as possible extreme heat illness and interventions. So I mentioned the insurance and financial systems. So we're seeing a shrinking of the market. We also are seeing whole communities being mapped out here. This phenomena currently referred to as blue lining, parallels of redlining. So we really need to have a broad conversation about what are potential risk models, of public and private, to address this growing risk. So the economic investment in a home, in businesses are protected. So, we convened environmental commissioners from 5 states. And one of the striking recommendations or observations from them is that their the agency reps from other agencies were not at the table with respect to extreme weather. And there was a study done by Pew Foundation that concluded that there was not really a rigorous process across the country in state or local budget processes to understand, identify all the variety of needs in terms of preparedness and the role of bringing in community partners in preparedness. So this includes budgeting, increasing staffing at the state and local government level, includes resourcing to partner with community-based organizations, and really includes how does a local government work with more power systems, hospitals to kind of make sure that those institutions are prepared. So, let me close this section by saying that emergency preparedness cannot be relegated to emergency response officials. While they have a really important role, I used to run the country's emergency management office at EPA, and those folks who play that role are really critical. But each of you have a really important role in protecting yourself, your family, your neighborhoods. It could be in community organizing engagement to understand how best to get their message, understand the vulnerable population, understand special needs, transportation, how to best communicate to your community the right language or in the right manner so they get the message and know what to do. Training, making sure people are trained to know once you get a notification, knowing how to evacuate, having the mechanism to evacuate. Urban planning. Urban planning is really critical. So knowing that where homes should be built and should not be built. Making sure that that we retrofit homes to address things like extreme heat and increased flooding. And I mentioned public health systems. Energy issues are huge. Lower income residents have to make a hard choice between cooling themselves or having to pay or maybe not being able to pay for the higher energy costs, which is skyrocketing around the country. And then, financial risk, transportation risk, and all of these need to kind of come together in terms of empowering communities, but also translating that into policies and budgets at the state and local government level. So now we're going to spend some time focusing on extreme heat and the work of partners. Extreme heat is it's kind of an unnamed disaster. Hurricanes have a name. Press pays attention to that. Press and others are not really paying attention to the gravity of extreme heat. It cuts across housing, energy, labor. Again, as I mentioned earlier, it's the #1 cause of death. And even that number is undercounted because emergency rooms and coroner's offices do not regularly document extreme heat as the cause. They will document the underlying health event, whether it's a cardiovascular event or a respiratory event. So I now want to introduce you to one of our community leaders, Thi Lam, who is currently the deputy director at SEAMAAC, he's been there for 10 years. SEAMAAC is one of the oldest and largest refugee-founded agencies in the region, with multilingual staff serving 18 distinct linguistic communities. SEAMAAC works on local, regional, and national levels, united by a shared commitment to build better communities and the mission to support and serve all communities. T?
Thanks, Maddie. And I think in the chat you're sitting in the dark and we all can see you. So if you
Oh, okay.
if you want to get up, just to turn
Okay.
the light. Okay, there we go. Hi everyone. So I wanted to thank Maddie for being able to really summarize a small list of 13 recommendations so far. And each one of those recommendations, I will tell you, could be its own seminar and webinar. But today, I've been invited to talk about our heat gap memo. SEAMAAC joined the Philadelphia Climate Justice Collective because we were afflicted with the same issues as many of our partners. Those partners include Esperanza, Mantua Civic Association, Overbrook Educational Center, as well as the Environmental Collaboratory. And we believe that we were all working for the same issues, and there's more power in number. Collectively, we had different priorities, but some of those priorities include expanding and inclusive cooling center access, energy assistance reform, heat resilience housing retrofits, healthcare and zoning interventions, as well as workers' protection. Where this is important is that all of these issues have dollar values. They cost a lot of money to implement, but these are some of the things that, from a personal perspective, what we see on the ground. So it is our assumption that cooling centers provide the most immediate relief for residents on high heat days. However, current cooling centers are limited to their capacity and equitable access. Those issues, what we have found in some of the bullet points are heat health emergencies declarations are oftentimes ambiguous, and I can go into details in a moment. The other ones is about promoting inclusive practices for cooling centers. Other ones include in-home cooling initiatives, education programs for residents in language, I might add. The other one would be strengthening the capacity of cooling centers and resources earmarked for specific community needs. And the last would be establishing a right of cooling comparable to the right of heat policies. From my personal experience, when the city declares a heat health emergency, it also depends on the time of the year. What we've realized is that in the city of Philadelphia, the city promotes its own cooling centers, and these are publicly owned um, sites that the city controls. Outside of that, there's only a handful of community-based organizations that have the capacity to host these cooling centers. These will prevent individuals with mobility issues that have geographical issues in terms of the distance that they had to travel to these cooling centers, as well as when heat health emergencies are declared. So, did you know that in June, you need to have at least 2 to 3 consecutive days of high heat above 95 degrees? But when we are touching August, it has to be above 100 degrees. So these things are not equal in terms of the communications that is shared with individuals. One prime example of why we have chosen to do our own metrics is that last June, there was a day where it was 94 degrees, and the following day, it was 95 degrees. So according to the city, does not constitute as the proper threshold for a health heat emergency. Therefore, community sites that are owned by the city were not open to the public. So SEAMAAC had to open our own facilities during that time. And then we were stuck with a high capacity of individuals that we were not able to serve. These issues also exist when you're talking about extended hours. For community-based organizations, if you have a heat emergency that lasts more than 2 to 3 days, that heat emergency doesn't really end when a rec center closes at 5 p.m. So there's no guidelines for community-based organizations to stay later, to close earlier, because the payment amount for the city-based system is the same for that of a community-based organization. The other thing is about programming and resource sharing, as well as in-language services. once you are declared as a cooling center in the city of Philadelphia, you do not have to provide anything else except for a facility and a cooling location with either fans or a I guess an AC system. You can provide chairs, but you don't have to provide water, snacks, resources, entertainment. So an individual who is going to seek services at the cooling center may sit there for 8 to 9 hours with no contact with any other individuals. Other issues I think that we are trying to announce is that we're wading into very dire times to make these adjustments. So the systems in ways that they are distributed to residents within the city of Philadelphia, as Maddie had suggested, was an opt-in system. So individuals who have language barriers are not able to be informed about some of these resources that the city are sharing. So these are some of the things that SEAMAAC and other organizations within our network is really trying to push an advocacy for changes that can be made on a broader scale that could affect particularly our individual constituents. The next portion that we wanted to address in some of the advocacy work that we've been doing is about the unequal healthcare access to heat-related services. So it is our assumption that cooling interventions are not integrated into healthcare access for heat-vulnerable populations. This includes partnerships with hospitals to track heat-related health incidents in real time, training for doctors and frontline providers to ask the right questions about heat exposures, and other long-term ideas that we have. So where we have subject matter expertise in this field is that SEAMAAC operates a health center located in South Philadelphia, where we see constituents there for health services as well as social service within the organization. One prime example was during the height of COVID, a lot of the comorbidity or issues that were causing deaths within individuals in the electronic health record system were all classified as COVID-related deaths. We see the same issues as they pertain to heat-related illnesses as well as heat-related deaths within the pool of individuals that we currently serve. These are individuals that are working day and night, oftentimes in very arduous conditions, and they are frontline workers, they are hospitality workers, they are individuals who are working outside in constructions and farms. And those individuals do not have the right parameters to both assess their conditions and when they're seeking help for any maladies that they have, those doctors are not equipped in order to diagnose those individuals or let them leave with any type of resource sharing that could better their lives. So I know we are short on time, so I'm going to end my time there with addressing the fact that when Maddie was talking on slide 16 about, sorry, Maddie, what we need to do, those bullet points are already in action. These are things that we're doing on a community-based level, such as ensuring that community institutions are formally recognized and participating in the emergency planning program. Early warning systems are certain things that we're working on within our own network of individuals. Others include vulnerable populations for preparedness plans. We are doing a lot of kind of data-driven work to be able to present and advocate for our communities. The other ones would be real-time community-informed data. So we're also working on a dashboard with all of our partners to be able to have data sovereignty so that we control the data, we control what we input into there, and we can use that data to better advocate for our communities. So I'll pass it over.
Thank you. Thank you, T. I appreciate that. So now let me introduce you to Dwayne Drummond. Dwayne is a prominent community leader and a grassroots organizer based in West Philly. He's best known for his longstanding role as president of the Mantua Civic Association, which is located in West Philly. It serves to inform residents and holistically represent their voices in development, zoning, and planning. Operating under the motto, plan or be planned for, their mission is to ensure community rights are protected while fostering an inclusive, equitable, and thriving neighborhood. Dwayne?
Thank you, Maddie. Um, I have two slides today that I'm gonna go through. And the first one is housing and high energy costs. If anybody know me, they know I always have a phrase or a quote to say. And before I go into this housing and high energy costs, I know I'm from Philadelphia, but Houston, we have a problem. We have a aging housing stock in Philadelphia, especially in disinvested neighborhood, also known as heat traps. This is serious across Philadelphia. We have dark flat roofs, poor installations, no AC, and a lack of trees due to years of disinvestment. The residents often have to choose between eating food, getting prescriptions, or their high energy bill. Which one is they going to pay? The data centers are driving up rates. We have an aging house stock in Philly, and we have a threat to our funding source, LIHEAP, in the state of Pennsylvania. We have a couple short-term strategies, such as incentives and alternative mechanisms at local and state level to abate high energy burdens to the low income residents and vulnerable population. Funding our community-based organizations such as Mantua Civic and like SEAMAAC and others to service communities with special needs and vulnerabilities to extreme heat and no home cooling. We don't have no AC. Transportation needs to even get to cooling centers like CMAC. Some of our long-term strategies is protecting and expanding the LAHEAP program and other alternative programs that provide cooling and heating assistance because it's much needed. So the final slide that I'm gonna do, like I said before, I always had to have a phrase or a quote, and Maddie kind of said this about the Mantua Civic Association, and our motto is plan or be planned for. Basically, in layman days term, what I'm saying is if you're not at the table, you're gonna be on the menu. So the Mantua Civic Association, we focus on developing our community with community and development, um, which um, urban planning, zoning, and infrastructure is a must to have a vibrant community. We integrate heat resilience into our land use and decision building codes, transportation planning, and even our public space, especially in them green spaces. Some factors that make some areas heat traps must not be replicated as expanded as we build this city in our community. Philadelphia, if you all know, is 250 years old. The country, because that's where the United States started at, in Philadelphia. Um, as community, we need parks, trees, an area of recreation so we can have safe havens and cooling spaces. And one thing that we are really, really fighting in Philadelphia and other places, especially in Mantua, section of West Philadelphia, is gentrification. We have to redesign greening policies to eliminate some barriers, high prioritize heat index neighborhoods, especially these areas which we consider the heat islands. Um, we have to have community-led planting and maintenance. It's about ownership. So we're doing these things to have green spaces, but we have to maintain them and own them also. displacement policies, we need to put them in place, including affordable housing. In my neighborhood in West Philadelphia, we have almost 900 affordable housing units is up for grabs. And these housing units is, they are old and we had to fix them up so our current and our future residents could have a safe haven and they won't have an environmental injustice um, that's going around and part of this nation and our community, and we need policy change. And the last thing that we must do, we must embed accountability and a state and sustainability to measure into climate adaptive investment. And we have to really hold our policies and our representatives accountable when it comes down to this urban planning and zoning infrastructure. So I'm not a green thumb specialist, but I am a community activist, and I see that it is things that's taking place in our communities and just not my community. That's why we formulated this collaboration, because just like our representative for CMAC said, it's strength in numbers. And we're not in this fight alone. And we all have to come together on a collective basis and have one voice because we are all fighting the same fight. So thank you.
Thank you, Dwayne. Um, so to close out, the real purpose of uh, this session is really kind of let you know the work that we collectively have been doing, identify the gaps, but it's really about how can we work together. So this is part of like how do we spread the word, build capacity around the country, um, create implementing actions through policy, identifying the data gaps and collect that data, and share knowledge and create platforms of convening of stakeholders to really kind of help support each other, bringing expertise and experience that occurs across the country with the real focus on the ground upwards. So based on all this work, we have recently convened with stakeholders the idea of establishing communities of practice, and they propose, and this is a virtual presentation that was actually developed during that session. So the initial focus of that folks recommend is focusing on public health and hospital systems, heat wave preparedness and right to cooling, and strengthening community partners. So, and this is kind of the vision statement of these communities of practices. And so if you're interested, we have a sign up sheet that we can make available. It's on the bottom of this slide. Really welcome everyone to kind of participate, contribute, and figure out how we can best establish actions, recommendations, resources to protect all of our communities. And we just released our second installment of our podcast, which focuses on extreme heat. We had representatives from SEAMAAC, from other parts of the country, talking about how heat is playing out in the neighborhoods. We also have a medical doctor talking about a better diagnosis of heat illness. We have a newsletter. If you're interested, please sign up. And then there's an upcoming book around how can we build community power to meet this moment. So thank you, and we can now turn to the question and answers.
Thanks so much, everyone. Really appreciate it, Maddie. And I think really building the first question I was going to go to really builds on what you were just saying, but maybe from a regional perspective. So the question we got was, how do you recommend engaging with different groups for regional collaboration, especially in more territorial environments? And I think maybe if you and even your partners want to take that as well.
Yeah, I don't know whether T or Dwayne want to answer that question first.
I can take a stab at it. It is nice to have in 2018, we did a strategic planning and we realized that data is not only power, but is also financial viability. And we had to be selective about who we chose as a partner to house some of that data. So when you're talking about collaborations in environment, like, in territorial environments, we all get it. The notion is that there's not enough funding ever. In this administration, there definitely isn't. But that doesn't mean that we had to stop working with one another. And the first thing we did is realize that across all five partners, generally 5 to 6 partners is generally how we decide to build movements. And we needed a partner that was administratively strong on the data gathering, and also breaking it down. So Drexel kind of made the most sense. We also needed an individual who had a lot of kind of willpower to do a lot of the grassroots work. We also needed an organization that had the ability to reach broad audience through different languages. So, in a nutshell, you want to be able to figure out what type of team you want to build in the environment that you currently exist. And that will allow you to be a lot more flexible. And the last thing that we would consider is that we all don't have to work on the same thing. Maddie will tell you every single time we convene, we're like, what is it that you're working on? We're all working on 6 different things at a time, based on the organization, but we're coming back to highlight the work that we're doing, and we're considering it as a collective win. So when you're figuring out what the collective infrastructure of how you consider what is a win and what is a loss, those are some things that you want to build into the foundation of your group when you're building kind of a movement.
Thank you. Dwayne, any thoughts on your side on regional collaborations? Or just collaboration generally?
Collaboration and partnership is the way to go. Strength in numbers.
Yeah, the only thing I will add is you have to have the collaboration that makes sense for you, and I think as T was saying, it's got to be folks that you trust, that believe in shared power, that believe in kind of community-driven kind of based approaches, and shared power is everything, right? Decision making. I think as T talked about, protection of community data, sharing of resources. In fact, making sure the resources are tilted towards the community-based organizations that have historically been under-resourced. So those are some of the approaches that we take. Next question.
Yeah, maybe just layering onto that, a question that just came in was, could you speak to maybe any kind of systemic differences or how to work across rural, urban, and suburban areas, and if there's any experience with that? It says also, is this work all to work with places for vulnerable and all those different political divisions?
Yeah. So let me give a shot at this. So I mean, despite both the political reporting and the political system, if you go beneath the numbers, a majority of Democrats and Republicans believe in proactive action for extreme weather. So if you go on Pew Foundation's polling systems, right, a majority of Republicans, majority of rural communities want to invest in making their homes more resilient, want to invest in preventing actions from flooding. So I do think that there is an opportunity to build bridges in and because at the end of the day, extreme weather is about protecting your family, protecting your community from death and injury and economic harm. So I think that there are opportunities, there are examples across the country, you know. So I guess that'll be my answer. I don't know whether T or Dwayne have a separate answer.
I have a really quick anecdote on this. So outside of my work at SEAMAAC, I used to, on my family side, we were doing a lot of development for hotels and, also large corporations. And the best way is finding alignment. You really don't have to agree with them all the time. But when you're talking about um, how people perceive it, Maddie's correct in that it's not about party lines at this point. Everyone in a capitalistic society really just wants to have self-autonomy and also the ability to make money. So an organization like Hilton Corporation, they are doing 10 times more with 10 times more funding about climate resiliency, climate adjustments before they make a purchase, before they, expand to a rural area, before they decide like, what's their market cap. So you have to look at cues from the corporate side, both from Democratic and Republican side, to see what is happening in your community, and you have to figure out how you're going to align with it or how you're going to oppose it. So I would say like, that's the only political divide that I see is whether or not you're going to be a change agent within your community or whether or not you're just going to let things happen. And we're seeing that with data centers now as well, which is another thing that we're fighting on top of 10,000 other things that we're fighting.
Yeah, yeah. Next question.
Yeah, we had a question about cooling centers here. Oh, I see you've answered that, but I don't know if you want to make that a more public
Yeah,
answer for
yeah,
around
maybe.
gaps, especially at night in cooling centers and data.
Sure. So T, you may want to talk about. So my answer in the chat was yes, cooling centers don't typically open up overnight when they are actually opened, and then I record it. So T, you may want to add anything to that.
Yes, so this is kind of our push for why community-based cooling centers are more important than anything else, because there's definitely a need. We recently just had a meeting and we realized that there is no heat office, right, Maddie, in the city of Philadelphia. In other areas where there are extreme heats and also extreme weather, you have an office that is designated towards it. If we had an office, that individual or kind of like that commissioner would immediately figure out a way to extend some of these hours for some of these facilities. Right now, it is still beholden on the community-based organizations to extend their hours. So a lot of time you see churches, you see community centers being open way later than some of the conventional areas. For example, when you're doing heating centers in the winter, those stay open overnight. Those are inescapable realities. But right now, politicians and individuals in government are able to get away with it because it's a progressive thing that happens. You go straight from spring to summer. There's not a lot of time. And then we also have to figure out in terms of when we do the advocacy work. So advocacy is like the major issue. We really try to push for a lot of these heat warnings, as Maddie will tell you. He's trying to push it for in uh, February, March, and April, and people are like, "It's still cool out. It's never going to be on top of somebody's mind." But it's not doing what is kind of popular. It's doing what is necessary so that we can get the amount of leverage that we need.
Yeah, yeah. I'm just to underscore. Unfortunately, heat is not viewed as one of the top priorities in government right now. And I think as T noted, there are a handful of municipalities that have a heat officer that have dedicated budget, but it is simply not the case that there is dedicated budget. So if you contrast that with particularly in the South in terms of resourcing for hurricanes, we really need to treat heat as the crisis that I think it is, in terms of resourcing, senior level, executive level attention, an individual charge of the responsibility, an outreach strategy that touches all communities and all community-based leaders. I think we need to have a comprehensive approach. Again, to reinforce, we need to have a budget that supports all of that. Other questions?
Thanks, Maddie. We had a question in the chat about misinformation, particularly with reference to partisan ideology affecting misinformation here in North Carolina with Harvey, or any other systemic factors that contribute to misinformation.
Yeah, I mean, I would say there was a particular group. I'm not going to give them any publicity. They're a national group that was behind that misinformation. It had a taint of partisanship. You know, there was a bit of connection of climate denial, right? But you know, I do think there are ways of I mean, I think we just need to we need to recognize that disinformation is a factor in our life and have proactive strategies, you know. And every incident, I think we should expect disinformation. We just need to be able to organize ourselves way in advance so we have the proactive messaging strategy. So we make sure people have the capacity, the resources to both to advocate for their needs, but also address disinformation. And that's probably an imperfect answer to that question.
We have one more question in the chat, and that is, oh, and we had another one just come in, but are there examples of hospitals or public health groups working to connect premature deaths and illnesses to heat anywhere in the US?
Yeah, so I mentioned the community of practice for health and hospital systems. That includes public health practitioners from health systems. So if you're interested in doing that, please join. So I would say the practitioners are really on board. I think there's a disconnect, frankly, between the practitioners and the hospital systems. And that's what we hope to kind of break through, you know, trying to get the leadership of hospitals to understand the needs and the resourcing to invest in that. I guess I'll answer the next question. I'll read it to you. There have been a number of traditional allied fields, name, planning, outreach, and engagement. I'm curious, who would you love to work with that is avant-garde outside of usual suspects from near and far afield? What would be the new thinking bring? Well, I know it's a very complicated question, Amalia. I would say that we want to use our traditional fields. Let's begin with that, you know, because I think there are tremendous needs in terms of new fields, I guess. But I know that bringing in artists, you know, and the artist community is going to be really critical in terms of a public message, in terms of other ways of engaging communities. So that's the thing that I can think of, but I don't know whether T or Dwayne have thoughts of like other experts fields to bring in.
It would be the apparel, the apparel sector. That has worked. So I just came back from Japan, and everybody is appareled correctly. And you know that is not just kind of a public messaging. It is a paradigm shift in terms of how people treat the weather. So whether or not you're leaving kind of like with hats on, you're holding an umbrella when it's a high heat index, and you have dehumidifiers in the house, fans that are readily available. That is like a sector that has marketing potential. They know their clientele fairly well. That would really help further some of our work that naturally isn't really in this space currently. But throughout Asia and Southeast Asia, South America, these are all kind of major players in the heat space.
I think also bringing an individual who has been affected by it too, with some professionals also.
Yeah.
Great, thank you all. I think that's it for our questions we've received. I think we have a few more minutes if we want to go to closing remarks from you all. And Maddie, you want to close
Yeah,
us
sure.
out?
Might like you turning off. Well, I mean, I would say to meet this moment, it really requires all of us. I use the phrase building community of communities, right? I mean, building the learnings, lessons, and solutions at a community level, and then building communities of communities to share those lessons. Because I think we're at a moment where we really need that. We know the current stance of the federal government in this space. So it's more important than ever to build these communities of communities. So we would love for you to stay connected, join us, join our communities of practice, sign up for our newsletter, listen to our webinar, and share what is unique to you. What are lessons that you've learned? So we'd like to really create a platform for the sharing. So that'd be my pitch to kind of join us. I don't know, T or Dwayne.
Um, Keep doing amazing work. I think we've had the privilege of presenting here today, but this is, 4 or 5 years of a lot of analytics. Oftentimes we lose steam. Sometimes, we miss opportunities. But hearing when we're doing research about all the amazing work that's being done across the country really gives us a lot of hope. But it also strengthens our pitch, especially on the next phase where we're really going to push forward a lot of the advocacy recommendations for things that we want to change within the policies in the city of Philadelphia. So all of that really helps, but having models that are comparable to things that we want to test out, especially in the city of Philadelphia, really helps.
Yeah. So there were a couple of folks who asked for the links to the newsletter. I'm gonna try to put that link here. So that's the newsletter, and then I guess Susan, can we get this slide deck to everyone after the
Yep.
call? Okay,
We'll
all
be
right.
sending out all the materials here and we'll reshare the links that we shared in the chat, including the newsletter. So you'll get everything that we've gone over here. So
Okay,
no
all right.
worries about capturing
So,
them.
so Dwayne, any last closing insights?
Collaboration make us all grow.
Thanks, Dwayne. And let me close by, thanking Anna, Susan, Angelica, from New School for really hosting us and really kind of being the impetus for the Centering Justice Coalition. It is more important than ever that we center justice, that we connect with each other, and keep using those words in the face of those who don't want to use those words. Appreciate you all and continue to want to be connected with you. Thank you. Be well. Take care.